Good afternoon. I am Komal Riaz. I am MPhil scholar from Government College, University, Faisalabad. Welcome to 5th International Conference on Applied Zoology 2022. I am going to moderate this session, including many talks from natural product, COVID-19 and epidemiology. First of all, we have talk with Dr. Muhammad Jalil Zore Zahra from Arya University, Iran. He will discuss about possibility of COVID-19 in animals and its control and prevention. So please, Dr. Muhammad Jalil Zore Zahra.
In the name of God, first of all, I would like to appreciate again from my respected colleagues in the Applied Zoological Society of Pakistan and other respected colleagues in our neighbor and friend in the Pakistan. The title of my lecture would be Possibility of COVID-19 in Animals and its Control and Prevention. Let me introduce you my colleagues, Dr. Muhammad Safat, Dr. Yazdan Pana, Dr. Ahmadi, Mrs. Yusefian, Dr. Khosravi as my colleague that assist me for preparation of this lecture. Appreciate all of them. In the introduction, severe acute respiratory syndrome, SARS, is a viral respiratory disease of zoonotic origin. The first identified strain of the SARS coronavirus species is severe acute respiratory syndrome related coronavirus SARS-CoV. The emergence of the severe acute respiratory syndrome SARS illustrates that coronavirus CoVs may quiescently emerge from possible animal reservoir. In December 2019, another strain of SARS-CoV was identified as severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. This new strain caused coronavirus disease 2019 COVID-19. Coronavirus can adapt to new hosts because of high mutation rate and high frequent recombination. Coronavirus belong to CoVs Nidoviral order Coronaviridae family, Coronaviridae subfamily. Based on the phylogenetic analysis, CoVs are classified into 4 genera: alpha, beta, gamma, and delta CoVs. CoVs of each genus are found in diverse animal species, including horses, cows, pigs, dogs, cats, birds, and birds. It has a biodiversity. Virus structure, it would be some technical characteristic of the coronavirus or envelope particle which may be spiral, and other characteristic about this matter, about the nanomet and other details. Animals infected with the coronavirus would be natural host, maybe from the possible transmission from the human and other wild animal and domestic animal, and transfer to the human. After that, from the human to human. And at this stage, we are arriving in the pandemic zoonotic disease. Animal infected with the coronavirus would be very different, and as you see in the dog, red fox, pig, wild bear, cattle, goats, rabbit, and a lot of animals may be affected with the coronavirus. And some of the summary of investigation of SARS-CoV in the other animal species and the method for the isolation and confirmation and the species and name of the animal, dog, pig, cattle, goat, rabbit, and other animals. It would be a summary of the investigation. Coronavirus in aquatic organisms. Few reports describe that the presence of the coronavirus in aquatic organisms. Coronavirus have been isolated from marine mammals, including beluga whale and bottlenose dolphin, as well as from freshwater cyprinid species such as white bream and fathead minnow. It was some of the marine animal in the ocean and in the sea that may be affected to coronavirus. Coronavirus in aquatic is summarized in many of the disease, genus, virus, and reference and gene bank of this material would be an aquatic organism. It is summarized. The clinical presentation in the coronavirus compatible sign and symptom may be vary by novel coronavirus. Fever and respiratory symptoms such as cough, shortness of the breath, and breathing difficulty. In more severe cases, the infection can cause pneumonia, acute respiratory distress syndrome, severe influenza-like illness, kidney failure, and even death. It would be clinical sign in the human. Occurrence SARS is thought to have originated in the Guangdong province of China with its emergence into human population sometime in November 2002. The 2002-2003 epidemic was characterized by outbreak worldwide including in Canada, Singapore, Vietnam, and China, originated in Guangdong province and spreading to major cities in another area, including Beijing, Taipei, and the special administrative region of the Hong Kong. This disease spread internationally along major rail line roads and resulted in 8,096 reported SARS cases in 29 countries with 774 deaths. The rate of the mortality 9.6%. The exposure setting for most cases were hospitals and among families and close contact of hospital workers. The novel coronavirus 2019 cause was first identified in December 2019 during an outbreak of pneumonia in Wuhan, China. The outbreak was initially associated with a market that sells mainly seafood in addition to chicken, bats, marmots, and other wild animals. Subsequently, with the limited human-to-human transmission, there was spread. Health and long-term care of cases in Wuhan and surrounding area. By mid-January 2020, cases had been identified in Thailand, Japan, South Korea, and other China cities, as well as the United States. The majority of initial cases outside of the Wuhan had a travel history to Wuhan, China. Modes of transmission. Coronavirus are a large family of viruses that are transmitted primarily through droplets and direct contacts. They are generally not airborne unless through an aerosolizing procedure. Some cause illness in people. Numerous other coronaviruses circulate among animals, including camels, cats, and bats. Rarely animal coronavirus can involve and infect people and then spread between people such as has been seen with MERS. Prevention and control, personal preventing measure, and infection preventing and control strategy. Personal preventing measure, there are vaccines against coronavirus. However, the most effective measure is to prevent transmission from infected person to susceptible persons. All individuals presenting to a health care facility with symptoms of acute respiratory infection should be provided with a surgical face mask and receive information about the importance of respiratory etiquette and hand hygiene. Ensure early recognition and prevention of transmission of novel coronavirus and other respiratory virus as the initial encounter with a healthcare facility. A strategy focuses on the use of routine infection prevention and control practice in healthcare setting and among healthcare workers. All healthcare workers should be educated in regards to routine practice related to infection prevention and control. All healthcare workers should wear appropriate personal protective equipment when assessing patients with suspect acute respiratory infection. Educate healthcare staff about the importance of strict adherence to and proper use of routine infection preventing and control measures, especially hand hygiene as well as isolation procedure and use of appropriate PPE, personal protective equipment. In conclusion, testing for SARS-CoV-19 available for animals, IDEX announced the availability of a test on 30 March, but neither the CDC, AVMA, nor IDEX is recommending pets be tested at this time. In announcing the availability of the test, IDEX indicated the thousands of the canine and feline specimens had been evaluated during their validation of the test and none had came up be positive. This result align with the current expert understanding that COVID-19 is primarily transmitted person to person and support current recommendation against testing pets for the COVID-19 virus. Dogs or cats with respiratory signs should be evaluated by veterinary for more common respiratory pathogen before looking to evaluate them for COVID-19. Can pets severe as vomits in the spread of COVID-19? COVID-19 appears to be primarily transmitted by contact with an infected person. Bodily secretion such as saliva or mucus droplet in a cough or sneeze. COVID-19 might be able to be transmitted to touching a contaminated surface or object, for example, vomit, and then touching the mouth, nose, or possibly eyes, but this appears to be a secondary route. A smooth, non-porous surface, for example, counterporous door knobs transmit virus better than porous materials, for example, paper, money, pets, food. Because porous and especially fibrous material absorb and trap the pathogen virus, making it harder to contact through simple touch. Because your pet's hair is porous and also fibrous, it is very unlikely that you would contact COVID-19 by petting or playing with your pet. However, because animal can spread other disease to people and people can also spread disease to animals, it's always a good idea to wash your hand before and after interacting with animal. Ensure your pet is kept well groomed and regularly clean your pet's food and water bowls, bedding material and toys. Let me thank you again for your attention. Have a nice time and bye on the next symposium.
Thank you so much, Dr. Muhammad Jalil Zore Zahra, for your nice talk. Now, I would like to invite our second presenter, Madam Parisa Muhammadi Sifat from Urmia University, Iran. She will talk on monkey poses, a serious public health challenge. So please, Madam Parisa Muhammadi Sifat.
Hello everyone, it is my pleasure to attend this international conference in Pakistan. And this is Parisa Muhammad Safad, a PhD student in agriculture scientist from University of Urumia from Iran. I want to talk about monkeypox poses a serious public health challenge. We have prepared this precious information under the supervision of Dr. Zori Zahra for anyone interested in. As you see here, there is a table of contents including some topics that I want to talk about them. In this slide, I want to talk about etiology. Human monkeypox is a zoonotic orthopox virus that clinically resembles smallpox, making it troublesome to diagnose it from smallpox and varicella. Monkeypox virus, a linear double-strand DNA virus that lives in the cytoplasm of infected cell, is one of the most virulent members of the orthopox virus genus, the family Poxviridae. Most human contamination happen in Central Africa, where screening is tested in remote areas with little scope, but may be conducted using evidence-based methods and educational material that educate general health workers on the crucial standard of these contaminations. There are two clades of monkeypox virus species, the West African clade and the Congo Basin clade. Here we want to talk about pathogenicity and clinical signs. The virus replicates itself at the site of incursion and then spread to regional lymph nodes. Monkeypox virus manifests with such clinical features as headache, fever, sore throat, swollen lymph node, and characteristic rashes or lesions that progress to that eventually cross and form a fresh layer, but the scars remain the skin surface. The rash typically begins to show within 1 to 5 days of the fever, and it is noteworthy that the patients are contagious when the rash appears. Lesions commonly occur in the face, 95% of the cases, and the polls and souls 75%. These symptoms generally appear after 5 to 13 days or a maximum of 21 days. The infection is self-limiting and is treated after 2 to 4 weeks. This disease, unlike smallpox, has mild symptoms and severe patients are observed in the children. In this slide, I want to talk about host immune response to monkeypox virus. The immune response of this virus is not sufficient. The monkeypox virus has made immune system response to infection the worst because it uses various mechanisms to evade it. First, natural killer cell or NK cell directly kill the infections that cause the monkeypox virus. IF and gamma and some pro-inflammatory cytokines such as TNF-alpha indirectly cause inflammatory responses in the infected cells. One of the biological features of the pox virus is its involvement, as it can help the virus to better survive or to evade the host immune system. This outer layer or envelope is derived from infected cell or host cells. A variety of animal species have been identified as susceptible to the monkeypox virus. Most mammalian species have been infected with this virus, showing that the host range is broad, and some of the infected animals in the table have been reported to be infected with monkeypox virus. As you see, animals infected with the monkeypox virus, like natural host species with their location, shows here in the table, like African head hogs, Gambian poached rat from Africa, African dormice from USA, short-tailed opossum from USA, and sun squirrel from there, and giant anteater from Rotterdam, and so on. In this slide, I want to speak about or talk about the mode of transmission. After the global eradication of smallpox, monkeypox appears to be the most common orthopox virus infection in humans. In addition to the routes mentioned that require direct contact, there are also assumptions about routes that do not require direct contact, such as airborne transmission. As you see in these two parts, I want to talk about animal to human transmission. This usually occurs through direct contact with contaminated animal or their bodily fluid, blood and skin lesion, and even bites from an infected animal. The second part is about human to human transmission. It requires close and long-term physical contact with patient lesion or virus contaminated objects or surroundings such as patient clothing or bedding. Risk factors. Several factors have been recognized to play a significant role in increasing the risk of infection, including prolonged physical contact with patient and family members, unsafe sex, male gender, breastfeeding in newborns, men who have sex with men, MSM, teenagers under 15 years, dealing with animals, living in rainforests. Epidemiology. Since 2016, human monkeypox has been confirmed in 10 African countries, including Congo, Libya, Central African Republic, Nigeria, and Sierra Leone. Each of the 6 US states had at least one incidence of monkeypox. Monkeypox virus was reported outside of Africa on May 26, 2022 in 15 European countries, 6 Asian countries, Australia, the United States, and Canada. A recent study indicates that the current outbreak originated from the West African clade. Since the start of the monkeypox outbreak and up to the 1st September 2022, 1,804,063 confirmed cases of monkeypox virus have been reported from 29 UA countries. In Asia, the number of new infections is low compared to Europe and other continents. 249 cases as of 30th August. About 86% of the cases are detected in Western Asia. As you see, we have the column about epidemiology from countries. We have the prevalence analysis, in which it is clear since mid-May 2022, more outbreaks have been observed in American and European countries. At the time, certain diagnostic methods have been confirmed and used. The specimen for laboratory include a skin lesion, crust, and fluid in the vesicle or pustule that may contain the virus, the patient's blood, and blah blah. And now I want to speak about we have several there are several common diagnostic methods, including molecular method, serology, culture, and immunofluorescence. Phenotypic methods. Molecular methods. The most accurate diagnostic method is polymerase chain reaction, PCR, or RT-PCR. Serology. Monkeypox can be diagnosed by detecting IgM and IgG in the serum after about 8 days from the appearance of the rash. Culture using cellular or cheek coriolytic membranes in isolation aligned with SS on ACL on DNA assists the detection of virus. Immunofluorescence, the less effective way to detect monkeypox virus, since it can get misdiagnosed from other pox viruses. Phenotypic methods. It is necessary to pay attention to similarities between monkeypox virus rashes and other members of the pox virus family. Observe the specific manifestations of monkeypox, such as lymphadenopathy. As you see, here we have the table of PCR methods and gene sequences and which type is more definite. In this method, RT-PCR is better than LC-PCR. While monkeypox virus is re-emerging as a treatment and raising international concern, most patients recover without a specific therapy, usually after 4 weeks. However, public information and education is crucial. However, the clinical signs of monkeypox virus are mild and known to be self-limiting. And here there is several drugs have been recognized to affect the healing process of disease, including fever, tecovirimat, and VIGIV vaccine or immunoglobulin intravenously. Fever is this antiviral drug can act as an inhibitor of DNA polymerase. The complete and definitive clinical results are still unclear. Tecovirimat, approved by FDA and EMA, also can be given orally. VIGIV vaccine can be used to treat monkeypox infection. Observed studies have proven that it can reduce the possible side effect of the cowpox vaccine. In this slide, we want to talk about control and prevention of monkeypox virus. Multiple measures that assist the infection from spreading include isolation of infected persons in separate rooms and avoiding any physical contact with them. Also, healthcare professionals should be equipped with standard gloves, masks, and gowns. Common approaches to safety, such as washing frequently, can definitely be effective too. There are some ways to control or prevent the spread of the disease. One study shows that vaccination is an effective way. Prescribed and used are commonly known as smallpox vaccine, monkeypox vaccine. The first one description is one of the most effective ways to protect communities is smallpox vaccination based on newly studies. Injection after 4 days of close contact can play an important role in disease prevention. There are still conflicts about how long the given immunity lasts, but pieces of evidence report that after smallpox eradication, vaccination has been discontinued. Thus, new generations are more susceptible to infection. After almost 3 decades, vaccinated populations against smallpox have a lower likelihood of infection. The second one is monkeypox vaccine. It can be administered for persons with a high risk of infection like healthcare workers or population with a large number of newly cases since 2019. GYNNEOS 2-dose series vaccine approved by FDA is administered. Here we go. Eventually, we achieve conclusion. After the smallpox eradication, monkeypox virus has been known to be the most prevalent orthopox virus. Then informating the expert and public is quiet indispensable. The clinical exhibition of the disease is remotely indistinguishable from smallpox or chickenpox. Thus, we need laboratory tests for diagnosis, precise diagnosis, avoiding close contact with infected person or infection suspected animals is vital for prevention, and patients should be quarantined. Uh, Nevertheless, the risk of pandemic is low. Governments and global public health should not ignore the dangers. And thank you for your attention.
Thank you so much, Madam Parisa Muhammad Sifat, for your informational talk. Now, I would like to invite our third presenter, Dr. Awais Masood from Livestock and Dairy Development Department, Government of Punjab. He will talk on probing the anti-diabetic effect of Ocimum sanctum lin, holy basil leaves extract on alloxan-induced diabetic rabbits. So please, Dr. Awais Masood.
Bismillahirrahmanirrahim. My name is Dr. Awais Masood. I am working as Deputy Director Livestock in Livestock and Dairy Development Department, Punjab. Nowadays, I am doing my MPhil in microbiology in University of Veterinary and Animal Sciences, US, Lahore. Today, I want to present my research work probing the anti-diabetic effect of Ocimum sanctum lin holy basil leaf extract on alloxan-induced diabetic rabbits. As we all know that diabetes mellitus is a worldwide problem. It has two types, type 1 and type 2. Type 1, which is juvenile onset diabetes, is permanent and it involves usually damaging of islets of Langerhans, while type 2 is usually considered as due to environmental factors. WHO says that it is increasing day by day, and Pakistan is at 7th position out of 10 highest prevalent countries. We know all that medicinal plants have very importance in treatment of different type of diseases. Among them is holy basil, which is also called Ocimum sanctum lin leaf plant, which is which has quite importance in treatment of different types of disease conditions. This plant in Pakistan is usually known as tulsi, or also called as Niazbo. It is usually known by its seeds, which are toham malanga, which are being used in summer season. Holy basil leaves have a sacred value in India, and in America it is declared as generally recognized as safe GRAS plant by FDA. This plant is very important in treatment of different types of diseases. I retrieved the idea of its effect on diabetes from different types of hukma. In Ayurvedic or Hakim, use this plant for treatment of anti-diabetes. So my study is somewhat a preliminary type of study, which involves scientifically inspection of the plant for use of for diabetes. This study involves the use of rabbits, which are lab animals. We prepared ethanolic extracts of holy basil leaves and we did phytochemical analysis, detail of which will come in next slides. We did animal trial. We took 25 rabbits and made 5 groups, having 5 rabbits in each. T naught was control group, which was first group, and it was given only placebo feed or normal feed, while other 4 groups, T1, T2, T3, and T4, were induced by diabetes by a diabetogenic agent, which is called alloxan. After 72 hours, we did blood glucose test for confirmation of diabetes. As all we know that diabetes have 2 major roles, which are weight loss, continuous weight loss, and increase of blood glucose. So for monitoring of these 2 parameters, we conducted 4-week study, and each and every week we did these 2 tests. While we did complete blood counting, liver function test, and renal function test at start of experiment before injection of alloxan, and at end of experiment at when doses were completed. To T naught with this graph, table shows you that healthy animals were given normal diet, while T1 group was also given normal diet, while T2, T3, and T4, these all were given alloxan to induce diabetes. So these were diabetic rabbits. These were given 100 milligram, 200 milligram, and 300 milligram doses of holy basil leaf extract. In results, you can see phytochemical analysis, and you can see that total flavonoids are much more in the holy basil leaves, while antioxidant activity is much higher, which makes this plant useful for different types of disease conditions, for treatment of different types of disease conditions. We also can see that in our study, we observed that while increasing amount of this holy basil leaf extract, we gradually have controlled blood glucose level, while also weight of loss was minimum. So 300 milligram dose have much more effect, significant effect than other doses. As I already discussed, that FPG and weight loss were measured in weekly basis, and we observed that 300 milligram dose gave maximum result. CBC before and after, when we were compared, we see that monocytes, lymphocytes, and ESR were increased, while granulocytes were decreased somewhat. While LFT shows ALT was somewhat increased, while liver kidney function test showed that blood urea level was increased after treatment. Pre-treatment values were down. If I conclude my experiment, I would like to say that these holy basil leaves can be used for treatment of different. While I conclude my study that holy basil leaves, when used for treatment of diabetes, they decrease blood glucose level, and also minimize the weight loss. Obviously, by increasing the dose rate, they have more effect. Our biochemical tests like LFT and RFT showed that they have minimum toxic effect on liver and kidney, while hematology also showed the same sequence. So in my opinion, to establish pharmacological significance of polybasal leaves. Further investigations for dose rate and safety margins are necessary. Thanks for patience. Allah Hafiz.
Thank you so much, Dr. Awais Masood, for your impressive talk. Now, I would like to invite our fourth presenter, Dr. Samreen Hayat from Government College, University, Faisalabad. She will talk on biofabrication of zinc oxide nanoparticles using Acacia arabica leaf extract and their anti-biofilm and antioxidant potential against foodborne pathogens. So please, Dr. Samreen Hayat.
Assalamu alaikum. I'm Dr. Samreen Hayat from Department of Microbiology, Government College, University, Faisalabad. Today I'm going to present the topic that is biofabrication of zinc oxide nanoparticles using Acacia arabica leaf extract and their anti-biofilm and antioxidant potential against foodborne pathogens. Before moving towards my presentation, I would like to thank to organizing committee for providing me chance to present my research work here. Here is outline of my presentation. It includes objectives, introduction, methodology, results, and at the end, I will discuss about future implications and conclude my presentation. What were the objectives of the front study? Basically, we have synthesized zinc oxide nanoparticles from green source, that was Acacia arabica leaf extract. Since when we talk about nanoparticles, these are actually particles having a diameter usually in the range of 1 to 100 nanometer, and because of their smaller size and high surface area to volume ratio, it has been expected and definitely it happens that their antibacterial or their biological activities would be enhanced as compared to their counterpart. So that's why we focused on zinc oxide. We focused on nanoparticles, particularly zinc oxide nanoparticles, and we have checked their antibacterial and antibiofilm potential. Moreover, antioxidant potential of these green synthesized nanoparticles was also tested by using DPPH radical scavenging assay. If we talk about why we have selected foodborne pathogens, because foodborne diseases, they have been emerged as major public health concern across the globe, and one of the estimation by WHO, it was estimated that more than 30% population, even in industrialized countries, it was affected by foodborne illnesses. And major culprits, definitely there are a number of pathogens that are involved in causing such type of infections or diseases, like fungi, viruses, but bacteria, they are considered to be the major one. Particularly, most important foodborne bacterial pathogens, they include Salmonella species, Escherichia coli, Klebsiella pneumoniae, Pseudomonas, Staphylococcus aureus, Listeria monocytogenes, and number of other organisms are also there. And important concern regarding these foodborne bacterial pathogens is that they are also antibiotic resistant. No doubt across the globe, this threat has been emerged a long time ago, and the situation is becoming problematic day by day because of misuse, you can say misuse of antibiotics, overprescription of antibiotics, although warning has been also put on, but still the situation is not in our favor. And another important aspect that contributes towards the antibiotic resistance among pathogen, it is their biofilm formation. Biofilms are actually assemblages of, you can say, microorganisms that can form, like you can say, that can form, that can live in a community, and they adhere to living or non-living surfaces, and they are actually enclosed by exopolysaccharide. And because of presence of this extracellular barrier, diffusion of antibiotics and other antibacterial agents, it will become difficult. That's why biofilm formers, they are more resistant as compared to their planktonic counterparts. So definitely there will be need to search or hunt for novel as well as natural antibacterial agent, and in order to cope the emergence of multi-drug resistance among these foodborne pathogens. And when we talk about alternative antibacterial agents, definitely oxides of matters like zinc oxide, they are of special interest because of their stability, safety, and non-toxic nature. In literature, you people can see a number of studies that can show biological activities of zinc oxide nanoparticles. And particularly when we talk about nanoparticle synthesis, various physical, chemical, and biological methods are there. Each will definitely will have its advantages and its disadvantages, but particularly green synthesis is considered to be eco-friendly approach. Moreover, it is also more reliable, cost effective as compared to that of physical or chemical methods that are considered to be more toxic as compared to that of green synthesis method. And in green synthesis approach, normally bacterial sources can also be used, fungi can be used, but plant extracts, more focus is on plant extract. So we use Acacia arabica leaf extract for the synthesis of zinc oxide nanoparticles. And if we talk about this plant, this plant source also has number of biological applications, particularly when we talk about their antibacterial and antioxidant potential. We have used multi-drug resistant foodborne pathogens like Pseudomonas aeruginosa, Staphylococcus aureus, and Salmonella typhimurium. And for the synthesis of zinc oxide nanoparticles, first of all, aqueous leaf extract of plant was prepared by cold maceration technique, and later on this extract was used as a capping agent as well as reducing agent for the synthesis of zinc oxide nanoparticle, whereas zinc nitrate hexahydrate was used as a precursor. And at the end of synthesis method, we have obtained white colored amorphous product of zinc oxide nanoparticle. They were characterized by FTIR, TEM, and XRD analysis technique in order to characterize them and in order to confirm their purity. Later on, in vitro susceptibility testing was performed by using two different methods. One was broth microdilution method, through which we determine minimum inhibitory and minimum bactericidal concentration of nanoparticle, whereas agar-well diffusion method was employed to check the antibacterial potential by using different concentrations of zinc oxide nanoparticles, and diameter of zone of inhibition confirmed their antibacterial activity. For antibiofilm potential testing, two methods were used. One was qualitative method and other one was quantitative method. In qualitative assay, tube adherence method was used. In this method, particularly ring formation around the walls of test tube, it indicated biofilm formation and presence of zinc oxide nanoparticle. It actually reduced the formation of ring around the wall, or you can say reduce the thickness of ring that was formed. Whereas in microplate assay, basically this is quantitative estimation of biofilm formers or adhered cells. In this method also, crystal violet staining was used. By using this stain, adult cells were stained, and then they were later on quantified. Their number was quantified by measuring the absorbance at 575 nanometer. At the end, antioxidant potential of nanoparticle was also tested by using DPPH radical scavenging assay, in which nanoparticles they were used at different concentrations, as well as standard was in the form of ascorbic acid. It was also used to check their antioxidant potential. Here are the results, and you people can see here, this is actually 10 micrograph of zinc oxide nanoparticles, and most of the nanoparticles, they were of rod shaped, or few nanoparticles they are also there that have hexagonal shape. So rod to hexagonal shape nanoparticles were formed, and the average size of these nanoparticles, synthesized nanoparticle, was around 20 nanometer. XRD spectrum of nanoparticles have also been shown here. And in XRD spectrum, well-defined diffraction peaks having 2 theta values at 31.72, 34.39, 36.23 and 47.44. These diffraction peaks, they confirm the presence of zinc oxide nanoparticle. Later on, FDR spectrum of the aqueous leaf extract as well as nanoparticle was performed. In figure A, you people can see FTI. This is actually FTIR spectra of plant leaf extract, and B is spectrum for zinc oxide nanoparticle. And if we are going to compare them, characteristics peaks indicating presence of different functional groups have been shown here. Particularly in case of B, you people can see here a peak at 545.35 wave number, and this peak actually belongs to zinc oxide nanoparticle. Whereas another peak that is visible in case of spectrum A, it is around 3443, and this peak corresponds to free hydroxyl groups of phenols that probably used for the capping of nanoparticles. Then in this table, you can see in vitro susceptibility testing results. MIC values and MBC values have been shown. In case of zinc oxide nanoparticles, MIC values range between 31.25 to 62.5 microgram per ml, whereas MBC against all 3 tested bacteria was 62.5 microgram per ml. Whereas in agar-well diffusion method, there was a dose-dependent response. By increasing the concentration of nanoparticle, diameter of inhibitory zone was also increased, and maximum inhibition was observed against E. coli, whereas Staph aureus, when concentration of 500 microgram per ml of nanoparticle was used, inhibitory zone was around 26 nanometer. 26 millimeter. Then biofilm formation, to check the inhibitory effect of nanoparticles on biofilm formation by these 3 pathogens, quantitative as well as qualitative method was performed. Here are the results of qualitative estimation of biofilm formation by tube method, and you people can see here positive control are those cells that were not treated with nanoparticles. Ring formation was there. These plus signs are actually indicating the intensity of color of crystal violet that was observed around the walls of test tube. Whereas by using nanoparticles at sub-inhibitory concentrations, these 2 concentrations were used. By increasing the sub-inhibitory concentration, the ring formation, it was reduced. So it means these nanoparticles, they were effective against biofilm formation even at sub-inhibitory concentration. Then quantitative method was also employed by using microtiter plate method. Absorbance was measured at 570 nanometer, and you people can see here in case of control cell, absorbance values was high, indicating greater number of adhered cells. Whereas when cells were treated with nanoparticle, there was a significant reduction in number of cells attached to the surface of microtiter plate. At the end, we have also tested the antioxidant potential of ascorbic acid, which was used as a standard in DPPH assay, as well as nanoparticles, and different concentrations were tested. And you can see here, in case of ascorbic acid, there was a dose-dependent response in antioxidant activity. By increasing the concentration, antioxidant activity was increased. Whereas in case of zinc oxide nanoparticle, initially there was an increase in the antioxidant activity, but at highest concentration tested, the antioxidant activity was reduced, probably because of less, you can say, absorption of, or you can say lower solubility of nanoparticles. This might be happen. So we can conclude that these nanoparticles that were synthesized by using a green approach, they act as promising antibacterial and antibiofilm agents against foodborne pathogens. And these nanoparticles, they were also non-toxic. Results have not been shown here, but we have performed a toxicity assays that prove that these nanoparticles, they are non-toxic to humans as human cell line. In future mode of action studies, they should be performed by using gene expression studies in order to find out the exact mechanism of these nanoparticles in terms of their antibacterial and antibiofilm activity. Thank you for your patience. Any question if you want to ask, let me know.
Thank you so much, Dr. Samreen Hayat, for your impressive and informative talk. Now, I would like to invite our fifth presenter, Dr. Huma Amreen from Government College, University, Faisalabad. She will talk on bovine colostrum and ameliorant for muscle growth and fitness. So please, Dr. Huma Amreen.
Bismillahirrahmanirrahim. Dear audience, this is Dr. Huma Amreen from Department of Nutritional Sciences, GC University, Faisalabad. First of all, I am thankful to the organizers for providing me a chance to present in such a big event, that is International Conference on Applied Zoology. And without any delay, I will be starting with my topic, that is the bovine colostrum and ameliorant for muscle growth and fitness. These are different outlines of my study. And if we talk about the bovine colostrum, you will be well aware of it. Then this is the first milk secreted by initial days of the cows when it gives birth. And it is yellowish, reddish, and thick liquid. And when we talk about the most important component of bovine colostrum is its composition, because it contains lesser amount of lactose, that is different from milk, and it is higher in fat, different type of growth factors, proteins, cytokines, vitamins, minerals, and different types of peptides and non-protein nitrogens. And this, you can see this is a pictorial representation of the bovine colostrum composition, that it contains different types of growth factors, immune factors, and the cytokines, different types of enzymes. And these all factors are important with respect to the health of the human body also. As you can see over here, that with respect to the respiratory tract, with respect to immune system, brain activity, and heart, this is important in every cell, in every system. The topic that we had chosen to fit this bovine colostrum was the sports nutrition. Why we had chosen this sports nutrition? Because if you look into the nutrition supplementations, there is a trend not only in the sports person but also in the active male, that they want to increase the muscle mass. They want such type of supplements which are higher in the protein, which are higher in such of the components which decrease muscle inflammation, which decrease muscle damage, because they will ultimately increase the muscle mass. So all of such qualities are present in this bovine colostrum. Therefore, we had chosen this bovine colostrum with respect to the athletic performance and muscle growth. These are different types of studies which have been done for bovine colostrum supplementation in sports. The initial study that has been observed, it was in 1997, and then it continued, and still it is in progress. The objective of the present study were to check the effect of bovine colostrum supplementation during training on the blood biochemical profile, and to examine its effect on muscle mass, growth factors, and fitness of the person. These are different methods that had been used. First of all, the study design was randomized control design. All the subjects had been part of this study randomly, and along with it, they were voluntarily a part of this study. And the sampling technique was convenient, and sample size was 40. These are different processes which have been performed for this bovine colostrum. These were procured from different dairy farms of Faisalabad and Gujranwala, and it was cooked until it is dehydrated. Then it was sieved and was packed into different types of packings, so that according to the different treatments that I will discuss later. Here are the different treatments which we had used, and this was 20 gram, 40 grams, and 60 gram of bovine colostrum, and the first patients have to take it with 1 glass of water. Therefore, the control group was only given 1 glass of water, and this was given, they were instructed to take this bovine colostrum 30 minutes before their activity. The study continued for 8 weeks, and the results were taken before the study and after the study. This is the inclusion criteria. Most of the people who join gym or who are doing their athletic performance, these are between the age of 18 to 35 years. Therefore, this age slot was taken, and it involved highly physically active males. And we had to looked into it that they should be willing to improve fitness. They wanted to improve the fitness and blood biochemical profile, and they are cooperative and determined to improve the muscle mass. And we had also tried one thing, that their baseline values are almost similar or near to each other, so that there is more precision and accuracy in the results. And the exclusion criteria, definitely, if we had taken 18 to 35 years of age, so age less than 18 and greater than 35 were excluded, and all the persons who had been using any type of supplements, medications, milk or soy, having allergies, and suffering from any type of disease were not participating in the study. They were excluded from the study. And some people who were athletes, but they were not taking any type of exercise for last 3 months, therefore these were also excluded from the study. And outcomes were measured. Not only the blood biochemical profile was taken, but also the physical measurements were taken, and these were based upon the BMI and 1 mile run test. This is for the fitness test, and we wanted to see how much do they gain the fitness to run 1 mile or 1.6 kilometer in a minimum possible time. And this was taken before and after the study. In the blood biochemical profiling, insulin-like growth factor 1, creatine kinase, and serum creatinine was assessed. Statistical analysis was done so as to know the significant difference, and so that we may know what is the difference between the values between the control and the treatment groups. This is the physical characteristics, as you can see over here, that there was increase in the weight to some extent as compared to the control group. As I have already told, that these were almost at the same age, height, and weight levels and BMI levels. But overall, it has been looked into that weight of the participants increased and BMI also increased. And one thing that I want to mention over here, that this increase was not in the fat mass, rather it was in the lean mass. And the results which I will be showing after this, that is in growth factors, you can see that muscle improvement may be related to those growth factors which have been provided by the wine colostrum. Yes, you can see over here that in the first, you can see this is insulin-like growth factor 1, and it has been increased dose dependently. T1, which was given 20 grams, and T2 which was given 40 grams, and then T3 which was given 60 grams. You can see over here that there was increased dose dependently. Similar was the case with the serum creatinine, that it also increased dose dependently. And one thing that I want to mention over here, that serum creatinine level is usually higher in sportsmen. Creatine kinase, which is related to the muscle injury, you can see over here that its value decreased with the increase in wine colostrum concentration, wine colostrum value that was given to the volunteers. And it shows that there was reduction in muscle inflammation and muscle damage. Therefore, you can see over here not only that it is providing the growth factor to improve the muscle mass, but it is also preventing such factors which are damaging to the muscles. So it is preventing the muscle injury as well as muscle damage. As the days are increasing, in both cases, you can see over here that there is less time being taken to conduct this 1 mile test. Therefore, on the basis of this was all about my study, and on the basis of this study, you can see over here that wine colostrum supplementation not only increased the weight and BMI that was resulting due to the muscle mass increase, but also it significantly increased the IGF and serum creatinine, whereas it caused the reduction of creatine kinase, and thus prevented the muscles from damage along with the increasing the growth. And it also improved the fitness and exercise performance as is shown by 1 mile test. On the basis of this, if we look into this study, then we can see this is the cheaper and easily available source of protein and different types of growth factors and immune factors. And if it is used as a supplement, not only for the sports person but also for the children, then it will not only increase the immunological properties of the people, but also it will help to gain growth and will help in development of the persons, not only the sports but also the children. These are different references that I have used, and thank you so much for your attention.
Thank you so much, Dr. Huma Amreen, for your impressive talk. You presented very well. Now, I would like to invite our last presenter, Madam Sadia Kharl from University of Sargodha. She will talk on in vitro antibacterial activity of acetate extract and solvent fractions against human pathogenic bacteria. So please, Madam Sadia Kharl.
Assalamu alaikum. I am Sadia Khair, PhD scholar from Institute of Food Science and Nutrition. First of all, I would like to thank you to providing me opportunity for presenting my research work in 5th ICAZ 2022. The topic of my research work is in vitro antibacterial activity of acetate extracts and solvent fractions against human pathogenic bacteria. The antimicrobial resistance is increasing day by day with more health risks, which mark the question on the development of modern medicines. Every newly developed antibiotic has been faced with a problem of resistance by microorganisms. In accordance with the emergence to failure in controlling antibiotic-resistant pathogens and the development of new microbial infections has stimulated the international community to develop new antibacterial agents. One of the main source in alternative to synthetic antibiotic is the antibacterial agents from plant sources. Plants could be a great source of natural drugs, and recently various pharmaceutical industries have incorporated plant-based compounds in medicinal plants, from medicine plants in synthetic drugs. Date fruit has been a subject of interest for many fruit plant growers since last decade because of its significant nutritional value and therapeutic potential. Nearly all parts of date palm trees are used in various ways, but the main part consumed by human is its fruits. Regarding the therapeutic potential, date fruit have been studied in various researches and proved its excellent anti-inflammatory, antioxidant, anti-tumor, and antimicrobial agent properties. The date seeds are less studied in biochemical research, but they have also been reported as strong antioxidant antibacterial agent against certain bacterial infections, especially gram-positive bacteria. The date fruit and their derivatives such as seeds are full of fibers, minerals, antioxidants, and various other phytochemical compounds that may provide or avoid oxidative damage arising from the pathogenic infections. The main objective and aims of this study was to prepare extract with various solvent fractions using ethanol and aqueous as extraction solvent, and antibacterial agent activity of date extracts against pathogenic bacteria. Procurement of raw material was done by collecting the acetate date from local market at summer stage. Pits were physically removed after washing the dates with water. Distilled water, the pits were physically removed and shadow dried for 4 days and then pulverized into fine powder. The flesh was stored at 4 degrees Celsius and then stored in plastic bag for further analysis. The quantity of date parts in various hydroethanol solvent fractions was according to the table, 150 gram of each part was whole pit, and flesh part was dissolved in 500 ml of respective solvent. Aqueous ethanol 20%, in which aqueous is 80% and ethanol 20%, for ethanol 40%, ethanol 60, ethanol 80, and absolute ethanol extracts were prepared according to the table by adding 150 gram of each part, whole, flesh, and pit in respective solvent. A whole extract was prepared by adding flesh and pit powder in equal weights. This is the flow line for preparation of acetate extracts. The dates was washed with distilled water. Then de-seeding was done manually. Pits was dried in a shadow dried for 4 days. Then grinding into a fine powder. Blending of flash extract, seed, wheat powder and whole part was done in a blender. Then extraction was done in a shaking incubator by placing the conical flask in shaking incubator at 35 degrees Celsius for 6 hours. Filtration was done. After filtration, the filtrate was centrifuged at 4500 RPM for 10 degrees Celsius for 15 minutes. Then the filtrate was concentrated in a rotary evaporated at 3000 RPM for 30 degrees Celsius until 1/4 of the original volume was remained. The storage after that, the extract was stored at minus 20 degrees Celsius for further analysis. Collection of bacterial strains. The bacterial strains were collected from microbiology lab, Institute of Food Science and Nutrition. The bacterial isolates used were Bacillus subtilis, Escherichia coli, Klebsiella pneumoniae, and Pseudomonas aeruginosa. The preservation of these bacterial strains were done in a nutrient-agri medium, which were incubated at 35 degrees Celsius for 24 hours prior to antibacterial assay. The antibacterial activity was done with this diffusion method, in which the culture was prepared at 3 × 10⁵ CFU/ml per ml concentration. The bacterial cultures were incubated for 24 hours in nutrient aggregate in petri dishes at 35 degrees Celsius. Paper discs of each extract were placed on the surface of the inoculated media and incubated at 37 degrees Celsius for 24 hours. Kanamycin 30 microgram was used as positive control. Zone of inhibition was measured in nearby areas of disc. Research shows that significant inhibition of bacterial growth was done by date extracts, while among all parts whole exhibited the excellent inhibitory effect, and among the solvent fraction 60% fraction showed the highest inhibition. It was also found that whole extract was highly antibacterial in ethanol 60%. Peat extract exhibited strong antibacterial activity in absolute ethanol, while flash extract was good in aqueous medium. These antibacterial activities of date extracts might be due to phytochemicals in compounds in them. The mean square values of each solvents, parts and solvent to part interaction showed that significant inhibition was done against all tested pathogenic bacteria, against Bacillus subtilis, E. coli, Klebsiella pneumoniae, and Pseudomonas aeruginosa. The interaction between solvent and date parts for antibacterial activity against Bacillus subtilis showed that ethanol 60% showed the highest inhibition among all other solvents, that is 14.44 millimeter zone of inhibition, while among the parts whole, peat and flesh, whole showed the highest zone of inhibition, followed by peat and flesh part. Antibacterial activity against E. coli showed that ethanol 60% exhibited the highest zone of inhibition among all other solvents, while among the whole parts, whole exhibited the highest zone of inhibition, while peat and flesh part exhibited the least zone of inhibition. The interaction between solvents and date part for antibacterial activity against Klebsiella pneumoniae showed that ethanol 60% solvent fraction showed the highest zone of inhibition, while among the parts whole and peat part showed almost a similar zone of inhibition against Klebsiella pneumoniae, while flesh part showed less inhibition. Antibacterial activity against Pseudomonas aeruginosa showed that ethanol 60% showed the highest zone of inhibition, while among the parts whole exhibited the highest zone of inhibition, while peat and flesh part showed less zone of inhibition as compared to whole part. On the basis of above study, it was concluded that a sealed date part, especially whole part, was highly effective against gram-positive bacteria, Bacillus subtilis, and gram-negative bacteria, E. coli, Klebsiella pneumoniae, Pseudomonas aeruginosa, with high zone of inhibition followed by peat and flesh extracts. The results further concluded that whole part of a seal is highly recommended for the treatment of infection disorders, which might be due to high concentration of phytochemical compounds and their strong antioxidant activity. It is strongly recommended that acetyl should be incorporated as a protective agent against certain pathogenic infections by adding them in different foods during food processing in food industries and also in manufacturing of antibiotics in pharmaceutical industries. Thank you.
Thank you so much, Madam Sadia Kharl, for your informative talk. Next session will be moderated by Hafsa Maham. So please stay tuned and connected.